as Katusabe community, as you're aware, to access services offered at Mount St. Mary's Hospital, somebody had to first get a piece of land, get it on the market, get the money, and then go to Mbera Hospital, Winga Hospital, or some Kampala-based hospitals. So we thank God for Right Reverend Aquinas Francis Kibera Kambale for the vision. But also we want to thank the German taxpayers that they care so much about Africa. And they're driven and guided by the value system. I am my brother's keeper, I am my sister's keeper. That's one thing to get our partners, but it's another for somebody to use the funding for the intended purpose. You know, being a bishop does not change who you were, it reveals who you were. And just like President Lincoln said, any man can handle or face adversity. But if you want a character of a man or a woman, give them power. Where the power and religious power that resides in the office, in the home of a bishop. Look at how amazing our bishop is. Humble, down to earth, full of grace and mercy and humility. And I want to thank God for Bishop Aquinas Kibera. Now back to the point. A lot of policies the government put in place, a lot of them are not guided by research. They're not research guided. Government comes up with policies and programs that don't have adequate information, adequate evidence, knowledge, data, and science. So it is quite so important that every policy and a program that government comes up with must be guided by research or the evidence, or you have to base upon existing data. So what we do right now as government is you shoot and then aim later, and yet it's supposed to be you aim and then you shoot. So the fact that a lot of our interventions of government are not based on accurate research, evidence, information, knowledge, and data, our programs and our ideas or intervention as government are not making the intended impact because our interventions are misguided. Now you just talked about government withdrawing human resources from private medical institution. That in itself is a wrong strategy because the people or the citizens being served in a private medical hospitals or in private hospitals belong to government. So in any case, private institutions are facilitators, facilitating the work of government. So it's quite so important that we might have to rethink and reverse that decision because it's going to make or it's going to have adverse effect on the health service delivery system. Somebody asked about when you look at a lot of these things and you look at how much money has been sunk into this amazing facility and then you relate that with what happens. And there's a lot of corruption in government, and I don't know whether you're aware that every year this government loses up to 23 trillion shillings, with 1 trillion lost to procurement fraud alone. So what does that mean? That for government, of course, you have that's red tape, procurement red tape, and there are a lot of middlemen, there are a lot of gatekeepers, and everybody wants to really grab, or everybody wants to have their share. But of course, when you get back home here, you find a bishop and the priest, and then the reverend sisters, and then the entire Christian community. Those are people that have their hearts all into and anchored in on integrity, our good judgment, and honesty. And of course, those are missing links within the government. And that's the reason why, if you relate how much has been, if it was government, probably you'd be having only one block. That is something that is familiar with government systems. And I want to just through the minister to our local government, that the director will have to be, reinstated, and of course that is gonna send a clear message and signal to the rest of the medical community.